Hi everyone, my name is Christie Amundson. I'm a physical therapist with Impact Physical Medicine. Welcome to our new pregnancy series. This is episode 1. Impact Physical Medicine therapists have been treating pregnancy and postpartum clients for many years, so we decided to make a weekly series kind of chronicling through pregnancy with me to discuss common questions, problems that we often get asked as rehabilitation specialists here. And we also asked you guys to give us your most common struggles through the postpartum period and through your pregnancies. And we just want to make sure we cover everything. So if you didn't get a chance to chime in and have something that you'd like us to cover, please comment below and let us know, and we will try to get to it. Our first topic today, we're going to cover pubic bone pain, also known as pubic symphysis dysfunction, or depending where you are in the world, symphysis pubis dysfunction. We wanted to cover this topic earlier on because it tends to show up earlier on. Most of the time, people get this dysfunction actually in the second try, although obviously every pregnancy is different, every individual is different, so it may prop up for you in the third try, it may come even in the first try or not at all. But a little bit about me. I am 20 weeks pregnant. This will be my fourth baby, my fourth pregnancy, but between my husband and I, it will be our 7th kiddo in our family. My youngest is 2 years old, so my last pregnancy was about 2 or 3 years ago. And I myself started noticing pubic bone pain around the 15-week mark. So let's talk a little bit about kind of location of this. So your pubic bone is the bone kind of at the very low part of your abdomen. So if you take your fingers and kind of push along your lower belly all the way down, you'll eventually hit a bone. That's your pubic bone. It's actually made up of 2 bones, a right and a left, with a joint in the middle. That joint is one of 3 joints, along with your right and left SI joint, that make up kind of the ring of your pelvis. We will be talking about SI joint pain in a different episode. So the pubic bone is made up of kind of 2 types of cartilage, one that's on the end of the 2 bones, and then one that's a kind of cartilaginous disc in the middle. And then it's covered with some ligaments all the way around for stability. It is not meant to move very much outside of pregnancy. However, with pregnancy, because of our hormones, there are several hormones that contribute to your body getting more lax or loose. And one of those hormones, the main hormone that contributes to that, is called relaxin, adequately named. And that hormone acts upon your tissue to make it a little bit more pliable, loose, lax. It's very helpful so that when you are in childbirth, it helps the baby pass through the birth canal because it will loosen the ligaments in the front on the pubic bone as well as in the SI joint to allow this to spread a little bit and give you more space. However, it is not super desirable prior to childbirth, as many of us know. So the pain that if you move a little bit too much in that area, it can be pain right at that site, but it also can radiate. It can radiate out to your inner thighs, or it can radiate underneath into your pelvic floor or perineum, which is basically the soft tissue that runs between your tailbone and your pubic bone. So I wanted to go over 4 different things to consider if you are having pubic bone pain. So the first is modifying your activities. So some of your increased mobility is obviously natural and due to Mother Nature, so you may not be able to rid yourself completely of all the pain despite all of your efforts in trying different things and even trying maybe some of the other things on this video. So a good idea is always to look at what are the things that really aggravate this area and try to modify some of those and avoid some of those if you can. I know it's really easy for anyone to say, hey, just stop doing the things that bother you or stop doing the movements that bother you. But I think the reality that we all know is based on our life responsibilities, that's not always, we're not always able to do that. So you just do the best you can and you try to modify where you can. So the thing that usually aggravates or moves this joint the most, normal movement when we shift side to side. So when we shift right to left, like for example, when we walk or run, or even when we just stand up and we shift side to side, it is normal that our pelvis at these three joints does flex a little bit and move when we shift side to side, and it's supposed to do that. However, because these joints are a lot looser and move sometimes a little bit too much, sometimes that can be problematic. So trying to limit activities that involve those weight shiftings where you can is always a good idea if it's causing you trouble. So for example, when you're standing up, most people when they stand, they shift their weight to one side or the other, or if you're holding an infant or a toddler, we tend to kind of prop the child up on our hip like this. Anytime you're, again, shifting the weight, it's going to move that joint, and if you're getting pain, you may be better off trying to keep your weight a little bit more evenly distributed and making sure that you're not having a really wide base of support. So in other words, your feet aren't, a lot of times people stand with their feet about shoulder width apart, and I would recommend maybe making them a little more narrow, more like hip width apart. You certainly don't have to stand with your feet together, but having them be a little bit more narrow decreases a little bit of that stress, and just again, trying to keep your weight evenly distributed when you stand as opposed to shifting side to side. So also when you're walking, splitting apart this way, if you get a lot of pain when you're walking, or if you're one of the lucky ones that's been able to continue to run throughout your pregnancy and you get a little pain in your pubic area when running, if you were to shorten up your stride a little bit, so in other words, take a little shorter steps, that will stress that a little bit less and be a little bit less movement, and hopefully that will help. When we talk about splitting our legs apart this way, if you were to sit on the floor, play with the kids, trying not to, have your feet in a wide straddle or sitting with one foot out, one foot like this, trying to avoid those positions on the floor, anything that really splits apart. And also, if you're closer to the end of your journey here, when it comes to labor and delivery, if you're really having a lot of trouble in the pubic bone area, I would avoid positions for labor that have you really, really straddled out. So a lot of times that's, reclined on your back, having your feet really pressing out wide, or if there's assistants that are pushing your feet out really wide, I would maybe switch positions to more of a hands and knees or hands and elbows. Or if you really do want to deliver or can't tolerate those other positions, just try not to have your feet super wide or have people really pushing them really wide, because obviously that will stress that area. So another thing is when we dress, most of us, kind of without thinking, tend to put our pants on by balancing on one leg and putting our pant on here, or putting our shoes or socks on by putting one foot up on the chair or the stool. So instead of doing things like that, just sitting down and either just bending forward to do those things, or if you can't do that, trying to bring your leg up. I would recommend, if you need to, you can use your hands to assist that, to tie your shoes and put your shoes on and pants on that way. One of the biggest things people we find have pain with, pubic bone pain with, is getting in and out of the car. Typically when we get in and out of the car, we would step out with one leg, shift our weight, and go to stand up. So obviously, as you can see, that's splitting my legs apart quite a bit, as well as now I'm shifting side to side. So instead of that, what I would have you do is kind of swivel your legs at the same time out like this, and then stand up out of the car. If, kind of like my situation, if you're kind of sticking on your seat in the car based on the material on the car, seat or maybe potentially what you're wearing. If you throw down like a trash garbage bag underneath you, it allows you to kind of move really easily. The last thing I wanted to go over is getting up and down from the floor. So if you're like me and you have kids at home, or if you need to get up and down from the floor, most people would split their legs apart like this and kind of go down like this, often supporting their hands on their legs, kind of like a lunge position, and then same way getting back up like this. Obviously, again, that really splits apart your legs and stresses that pubic area. So if you can find a chair or a couch that you can kind of use for support and put your hands on it, and if you have pretty good range of motion and no knee problems, then you could go down like this and then back up. However, this does take, obviously, as you can see, my knees are bending all the way. So if I have knee problems where my knee doesn't bend as well, or I have knee pain, or I have some range of motion difficulties in my ankles, or just weakness, this might not be the best option for you. But if you can do this, you're going to push up like this, butt goes up first. You can use your hands to like lean on the chair as much as you need to. But if that's too difficult for you, you would lean your hands on the chair, or if it's a little higher, your elbows, and then you would walk your feet back slowly. So now I have about half of my weight on my hands, and I'm going to kind of squeeze. I'm squeezing my knees together, and I'm going to lower my knees down slowly. And as I lower my knees down, I'm trying to keep my back rounded, so I don't want it to look like this as I come up and down. That would not only put a little bit more pressure on your pubic bone, but actually it would put a lot of pressure on your back. So again, in coming back up, you'd put your hands here, or you could put your elbows down like this, and then you're trying to push your butt up first, like this. Again, I'm kind of squeezing my knees together, and then I'm going to take short steps, walk up like this, and it helps to kind of support that area and not really stress it when I'm splitting apart. So adjusting the way you do some of these things that we kind of just do without thinking throughout our days can take significant stress off of that area for you and hopefully make your days a little bit easier. So the next thing I want to talk about that can help are some support belts that help to support this pubic area. So I'm going to show you two different options that we have. There's lots of different stuff out on the market. The two that I have happen to just be the two that we carry in our clinic because we've found the most success with them with our patients with pubic pain. However, that doesn't necessarily mean we're certainly not endorsing these products, and we're not getting any kickbacks from them. So it just happens to be what we've found has worked the best. So the first one is an SI belt. Like we talked about in your pelvis, this belt is actually made more for your SIs in the back, but it is made to basically just compress the pelvis. And obviously in compressing the pelvis, the pelvic ring, it does stabilize your SIs, but it also will stabilize your pubic bone. This product that I have here is actually not a maternity SI belt, and I'm going to show you why. You can get maternity SI belts. There's certainly some good points to them, and then also some downfalls that I'm going to talk about. So this is it's called the Sorolla belt. It's a Sorolla brand. I will link the products below if you want to check them out. The sizing goes by your hip measurement. So given that this is not a maternity product, you would want to measure whatever your hips are now during your pregnancy that you would want to be getting the belt. But here, I'll show you. So this is what it looks like. And then I'll flip it over, and this is the sizing. All right. So if I open this, basically, if I were to put this belt around the pelvis. It really goes right around your pelvis bones here. One of the biggest mistakes that people make when they put an SI belt on is they tend to either put it too high or too low. So this particular belt is just one single Velcro belt, and then it has 2 elastic straps. So what I do when I put this on is I loosen the straps first, like this, so there's like a little gap. And then, and to be honest, this belt is one size too big for me because we didn't have the size that I wanted, of course, today when I was looking for it. So normally it would be a little bit smaller, but there should be a seam, or some of the brands have an emblem in the back that will show you both which way is up. So this is the emblem on this one that shows me which way is up. And then the seam you're going to put in the very center of your back. Velcro City here. So it'll go right in the center of, kind of like on your tailbone, really low. And then you're going to bring the belt around. Now, this belt, the reason I don't have a maternity belt is because, at least for where I'm at in my pregnancy right now, and sometimes it depends on how you're carrying, I can get away with this belt because of how low it is. Again, it needs to go, so if you feel your pelvic bones, it needs to go below your pelvic bones. But if you feel your pelvic bone and then you kind of push your fingers down, you should feel some soft tissue that's muscles. And then you'll feel another bone, that's your hip bone. So it needs to go above your hip bone. So I'm going to put this around like this, and I'm going to try to get it as tight as I can. Again, this belt's a little bit big, so normally it would come to about right here. And then I'm going to take these Velcro pieces, and it's better if you can have somebody help you, to be honest with this. But if you can't have anybody help you, what you're going to do is it's better to pull them both at the same time, not one and then the other, because that makes them asymmetrical. So if you take kind of a little bit wider base of support and pull, you're going to pull out to stretch them and then Velcro them down. So it looks like this, and come around and Velcro them down. So it gives a nice compression. So again, this is not a maternity, so it does compress really low in my belly. So if I was further along or if I was carrying really low, this would probably be really uncomfortable. They do make SI belts that are maternity. Usually they have like a little pad that's in front, or they will have an elastic, a little bit of elastic here, so it stretches a little bit more in the front. That's kind of good and bad. Like I was saying, a lot of times having the elastic on the belt itself kind of defeats the purpose, because again, you really want like a lot of compression in there to help stabilize that joint. And by adding elastic to it, you lose a little bit of that function. So if I take this off, I just want to show you why we like this belt. There's a lot of SI belts, but these pieces are stretchy elastic, but the main belt is not. So it does not, there's a lot of SI belts on the market that are like elasticy and stretch. And again, the point of this is that you can get it really snug, and it really kind of pushes or approximates those joints together and holds them in a better position for stability. So it's better if it does not stretch, the main belt, and then it has straps that you can use the elastic on. So that's the SI belt. The other belt, so obviously that's going to compress more on the sides. This belt is called a V2 supporter, and this is made more for compression underneath. So it doesn't compress this way, it more compresses and kind of lifts up in your pelvic floor and perineum. So this, the SI belt, by the way, you can wear that over your clothes. Obviously, I wouldn't put it over my shirt like I did, but put it over your pants and then just wear a shirt over it. This, you will not wear over your pants. It kind of looks like a female jock strap. But you would wear this under your pants, but I highly recommend wearing it like over some biker shorts or boxer briefs or something. Otherwise, it kind of tends to chafe your skin. So you put this on just like underwear. And I'll show you the box in a second. So I'm going to bend down and put it on because lifting my leg tends to bother me. So when I put it on, again, you kind of put it on just like underwear, and you're going to pull it up. Oops, my mic is going to get in the way here. Put that up there. So, has a nice little detail in the front here. So, this now, it looks and feels like underwear, but if you turn around, it has these straps in the back that Velcro. So, you want this strap to be relatively horizontal, and then you're going to pull these, you're going to pull them up, so when I pull them up, it kind of pulls through. Not so much that it's uncomfortable, but enough that you get some support through here. This is can be really good. A lot of our patients with pubic bone pain really, really like this support. It also is really good if you have any prolapse issues, or maybe you haven't been diagnosed with prolapse, but you feel a lot of pressure in your pelvic floor, feel like things are falling out. If you have that kind of pressure pain down here, this is really good for that. And I would say of the two, this is by far the most popular with people who have pubic bone pain to wear and feel better and get kind of instant relief without maybe added discomfort from the SI belt being, kind of pushing in here. So I'm going to take this off and I'm going to show you the box here. So this box, because it is a pregnancy product, it has a size chart that has pregnancy sizes on it. And it also talks about your current weight during pregnancy, but it also talks about your non-pregnant pant size. So I will say, for me, it does when you put it on, it feels tight, it feels like I might have gotten too small of a size. But it's not, I have to admit, I initially thought mine was gonna be too small for the size that it told me to get. However, I went up a size and it was way too big and didn't give me any support. So it is supposed to be really tight. All right, so that is the second thing I'm going to talk about. Now I'm going to move on to some exercises that can hopefully help you out to support and stabilize that area. The third thing that I want to talk about is the exercises that we want to do to stabilize this pubic bone area. So this becomes a little bit challenging because usually when our impact providers see a pregnancy or postpartum client or patient, we do a comprehensive eval that includes a medical history, a pregnancy history, and we do a lot of objective tests to determine the position that you may be in with your pelvis and hips and back. And this helps us to kind of decide which direction we go with the exercises. Sometimes it basically helps us to be able to tell whether it is maybe just an instability issue on both sides, or if perhaps one side may be kind of malpositioned or in a position that's kind of stuck and needs to be gently mobilized in a different direction to take the pressure off. So it is very difficult to say, any one exercise is going to work for all pubic bone patients because that doesn't exist, unfortunately. But we did put our heads together and kind of decide on 3 exercises in 3 different positions that we often prescribe for this problem. that I'm going to show you today. Obviously, these exercises are suggestions to try. However, they should, if they are effective, be helpful in alleviating or at least stabilizing. So in other words, in doing them, you should feel better or feel more stable after doing them, or during. You should not feel pain while doing them. So this is not about no pain, no gain, or let me push through it because I need to increase the strength of those muscles. If it's hurting, then don't do it. And it may mean that you need to try the other side and see if the other side also aggravates you. But again, anything that aggravates you, I would avoid. So the first exercise we're gonna do, is actually a sitting exercise. So you would normally be sitting in a chair with a back on it, preferably. I'm going to show you this without a back, just because I don't have a chair here with a back on it, but also I think it's easier to see what I'm doing. So what you're going to do is when you sit, you're going to roll backward a little bit so that your back, your lower back, would be pushing into the chair. And when you roll back, it's like you push your low back into your chair, so it's going to engage your abdominals a little bit. And when you do that, you're going to take one leg, either leg, and you may need to help your leg, but lifting your leg up and crossing it, kind of like what we talked about with the putting shoes on. So depending on how flexible you are, you may be able to kind of do this like, call it figure 4. Position, and you may not, you may be up here because of your range of motion. What you're going to do is you're going to shift to the side that is not up. So in this case, I'm bringing my right leg up, so I'm going to shift over my left kind of butt bone area. I'm going to round my back, push my back into the chair, shift to the left, and I'm going to clasp my hands around my knee here, and I'm going to push my knee out this way into my hand. So what I'm doing is I'm engaging my right butt or glute muscle. I'm also engaging my abdominals. When I do this, the key to a lot of these exercises is engaging more than one muscle around the pelvis to try to stabilize it from all directions. If I were to just do one muscle group, for example, like squeeze something between my knees, sometimes that might help. However, usually if you just take one muscle group only and engage it by itself, it's going to pull only in one direction on your pelvis, and that can often be kind of aggravating. So if I were to do the other side, I would bring this leg up and I would round my back and shift away from the leg that's up a little bit. And again, I'm going to clasp and I'm pushing my knee back that way. And it's really important that as I'm pushing, because a lot of times the tendency when you push with your knee is to want to arch your back and sit up like this. And that would be the opposite of what we're trying to do, right? We're trying to push back this way and use your abs. So we want your abs to stay engaged and pushing into the chair. You probably will not round this much because you'll have a back on your chair to push into. So you don't need to be kind of as rounded or as slouched as I am. So I'm going to show this just from the front so you can see the weight shift. So again, come up, clasp around. I'm going to round my back, push my back into the seat of the chair, the back of the chair. So I'm engaging my abs. I'm going to lean a little bit away from my legs so I'm heavier on the butt bone that's my foot's still on the floor. And I'm pushing out. So you notice I'm not really moving a lot, if at any, but I'm engaging those muscles and I am involving a little bit of a shift. So this helps us train or kind of retrain your body to be able to tolerate things that you have to shift with. For example, like walking. It's kind of inevitable for the most part that we have to walk and shift our weight side to side in order to do so. So this is trying to help retrain some of those muscles to be able to know a safe range to be able to stabilize during that weight shift. Okay, and the second exercise is going to be lying down. So if you're beyond the first trimester, you won't want to be flat. You'll want to be reclined. The other thing is the exercise that I just showed you, if pulling your leg up like this is too much pressure based on you carrying really low or being further along, you can do that exact same exercise lying down. So you would do just crossing up like this. You would push your back into the table or bed, whatever you're lying on, and then lean a little bit away from that leg as you push. So you could do a lying down version of that. The second exercise, I have a belt that I'm going to put around my thighs. You could also use a band if you wanted to. I like the belt better because it's stiff and doesn't move. If you use a band, you'll want to use a band that is super tough or tight. You would not want to use a really stretchy band. If all you have is a really stretchy band, wrap it around enough times so it makes it really tight. You could also just use like your belt from your waist. You want to belt it or put the loop so that your legs are about hip width apart. And you're going to move your feet out a little bit, but they should still be bent. And you're going to push down into the floor or into the bed with my heels, not the balls of my feet. When I push through my heels, I don't need my feet to come up like this. I want them to stay flat. So I'm pushing straight down, and as I push straight down, I'm going to curl my tailbone up like this. When I curl my tailbone, it's literally like the bottom part of my butt that lifts up. It is not like a bridge where you're lifting up like all the way like this. So I'm pushing my heels down. I'm curling up a little bit. This should make it feel like my back is pushing into the table. It should activate the back of my thighs. And then I'm going to push gently both knees out to the side. So this is where obviously I would not want a stretchy band because I don't want my legs splitting way far apart. So if you do have a band and they do move, it's okay to move a little bit back and forth as you breathe, but you don't want to have a ton of movement. So I'm rolling up so my legs are working, my abs are working a little, and I'm pushing both legs out, which engages both of my glutes or my butt muscles. I like this one as an option because it's not shifting at all. So if the first one your body doesn't like, and the last one that I'm going to show you actually also has a shift involved. So if your body does not like those two, then this is a good option for you to try. So with all of these exercises, you'll notice it's not a lot of movement. It's more just holding the muscle and breathing. You do not want to hold your breath. And as you do it, again, push your heels down, roll up, and then I'm pushing out to the sides. And I'm going to breathe. And I'm going to hold it as I breathe for several breath cycles, or you can hold it up to a minute and then come down really nice and slow. Same thing goes with all of them. You're going to hold it for longer as you breathe. It's not so much a repetition where you're doing 3 sets of 10 or things like that. You could do 3 or 5 in a row. The sitting up one, obviously you have one side and then the other side. So as I said before, you will want to try it on both sides, but if it doesn't feel good, so for example, if one side feels good and the other side doesn't feel as good, only do the side that feels good. It will not make you lopsided. Oftentimes that usually means that you probably have maybe a little bit of an asymmetry in your pelvis, and it needs to probably be the fact that you feel it better going one direction will usually help kind of reposition it more to a kind of a more normal neutral position. Okay, the last one is a hands and knees exercise. So when you do this one, you're going to go on your hands and knees. If this position is bothersome because it bends your wrists too much, you can use like a stool, or like I could use this wedge and turn it around and put my elbows on it like this. So you could do something with a stool or a cardboard box or something, put your elbows on that so that you don't have to put your hands and bend your wrists down. So if you're familiar with any yoga positions, this is going to start out looking like the cat position in yoga. So you're going to push your whole spine up to the ceiling like a rainbow or like a cat. When you round your back, I do want you to shift your weight a little bit forward onto your hands. And I also want you to tuck your butt underneath you. So you're pushing with both your shoulder blades and you're tucking your butt. But you do not want to make the mistake that a lot of people make, which is trying to over round like this, pulling their shoulders to their head or neck, ears, or pulling their chin way down like this. So you want to keep your head up and neutral. So you're going to round, tuck your butt under, shift your weight forward. And then, so this should be engaging your abdominals. And now you're going to shift your weight to one side. So I'm going to try going to the left. So I'm going to go over to the left a little bit. So my whole body needs to go to the left, not just my upper body or my lower body. So it's like as if somebody were to take you and take your hip and your shoulder and just kind of push you over. So you round out, shift a little bit. So now I feel like I'm heavier, like maybe 70% of the weight is on my left hand and my left knee compared to my right hand and my right knee. And I'm going to take my left shoulder and left hip and crunch them together. So I'm rounding out, shifting forward, shifting over to one side, in this case the left, and crunching my left side together. And then I'm going to hold it and breathe. And this is really important that when you breathe, that you do not go like that when you breathe and come up and down. So again, you're trying to really hold that position as you breathe. And it might feel a little bit restricted. And if it does, that usually indicates that you're kind of tight in your upper back or lower back areas. So this actually can kind of provide a good stretch in that area as you're breathing. Again, you're going to do both. You're going to try both sides. So you'll round, shift to the right, bring my right shoulder and right hip together, and breathe. If one side feels better than the other, you would do just that side. If shifting to the one side is bothersome, you could do this exercise straight, kind of like that cat pose, and just hold it here and breathe if this feels good to you. The shifting piece is nice because, again, it helps to retrain your body to be able to safely stabilize when you shift right and left when, like, for example, you have to walk. So those are the three things that I would recommend that you try. Certainly, again, if any of them bother you, don't do them. And that kind of leads me to my last thing, which would be seeking medical opinion or help if you're still struggling with this. So if you try a lot of these things and it's still plaguing you, you probably need to be individually evaluated. So you could see your OB or your midwife or whoever is your primary care physician that is monitoring your pregnancy. That's a good place to start. But a good place to go would be a physical or occupational therapy clinic that specializes in seeing pelvic floor patients and or pregnancy and postpartum patients. So if you're having trouble finding someplace, I would If you're just Googling different therapy places, just make sure you call before you schedule and make sure there's somebody there that has some experience with treating patients who are pregnant or postpartum, or have some experience treating pelvic floor, because it is a little bit of a niche in the therapy world. So although in therapy school we're all kind of taught the basics, it is something that's really, you would want some continuing education in to be able to really be able to adequately treat you. So thank you so much for watching, and please like our video, and if you we'll be back next week with episode 2. If you can subscribe to our channel, you'll get notifications, and it certainly helps us as well. If you have ideas for topics in the future, please add them below. You can check out the links below for our other Facebook and Instagram accounts. We really appreciate your support, and we will see you next week.